So when Dad and I first started this venture, we had two offices, one in Brandon and one in Plant City. And today, I'm proud to say that we now have 7 locations that range from across the bay in St. Petersburg all the way out to Winter Haven, Florida. We have offices in Riverview, 2 in Brandon, Tampa, and of course still Plant City. This is an amazing thing because there are so many people that fall into our large geographic area that we're able to care for people who work in one place and perhaps have a home in a different place. We're able to care for multiple different types of family members. Perhaps the parents live in Tampa and the in-laws live down in Sun City and can get to us in Riverview. So that ability to capture such a large market throughout the Tampa Bay area is very important to us, and it's something we're going to continue to search for areas that we feel we can help cover with another office location.
One of the unique features of Orthopaedic Medical Group is that we all had an opportunity to work with each other. Many of us trained together. In fact, most of us trained in the same location and were able to operate together. And we were able to really control quality of the people that we hired because we got to see them extensively before they joined the group. And we've continued a lot of that practice. So as we grow as a group, we have been able to maintain the utmost quality because we have such a good handle on the person, their skills in the operating room, and how they present to the patients and the options that they offer.
So one of the things that I love about Orthopaedic Medical Group is that we are a family. The practice was started by Stuart Goldsmith, and then his son Scott Goldsmith came and joined him. So it started out with a good family group and a real family feel. And we've continued that as we've grown and now added 7 additional surgeons to that team. The rest of us all did residency together at one point or another at University of Maryland, and so a lot of us knew each other, and that's how we kind of ended up here together. We recruited each other down to join and join and grow as this part of a family. I think that everyone that we've brought on, from our physicians to our athletic trainers to our physicians' assistants, have all kind of really embraced that family aspect, and we treat each other as a family and work together really well as a family.
Out of our 9 surgeons, 8 of us have actually all crossed paths at some point in our training, and that specifically was our residency and our trauma rotations in Baltimore at shock trauma. So we all have this kind of same mindset. That's number one. I mean, we have the same mindset of how we treat patients, what it means to be conservative, dealing with patients, talking to them, listening to them. So we all have that kind of same background. So that's number one. Number two, there isn't this incentive to do things that are out of your wheelhouse. So like I said, I will see hip problems, knee problems, I will do conservative treatment, but I'm not going to push my limits and do a hip or knee surgery that I haven't done since I was in residency. So since we all trust each other, all think the same way, all know each other, all get along, I have no qualms of handing that patient off to the best surgeon, even if it's not me. And I get that back too. So my partners, who maybe only do the minimally invasive sports med type things in the shoulder, if they need someone, perhaps someone that needs like a big shoulder reconstruction, well, I'm the guy to do it. So there's give and take between our partners.
I think we'd all like to say that we do the best technical job. I think that's a canned, easy answer. I don't think it's that easy. I think it's speaking about how we are from the mission all the way down to the boots on the ground. Really, everybody in this organization is here because they want to do a good job. They're passionate about what they do for people. They can bring a special skill set, whether it's surgically or on the phone or the athletic trainers or the therapists or whomever that might be. And I think it's a daunting task to build an organization like that. The analogy I give people is like, it's like going to the car dealership, or it's like going to a restaurant and maybe not getting that best experience that you've had. But then how do we make that bad experience or untenable experience better? Because we can go the extra mile of asking the questions and following up and talking with people. So I think we're not perfect. But there is this mission and passion around what we do that is all the way from the first person in the door to the last person to turn the lights out that makes that special.
I felt immediately at home with this practice. I mean, this practice was started by father and son, but you know, with the hiring of other surgeons and other locations, you still feel that close family ties with the other surgeons in the practice, despite us being in several locations. In addition, you know, because this practice has been here for so long, the community also feels that we're part of their family.
So there are so many special things about Orthopaedic Medical Group and OMG. Certainly from my perspective, joining my father in practice was incredibly special and unique. Dad started the practice 41 years ago with the intent to build a large group. And over time, it didn't pan out as he had initially anticipated. And it wasn't until I joined him in 2008 where we started to grow the practice to what it is today. And it's incredibly special to continue to have Dad as part of this ever-growing company and the care that we provide to so many people, rather than just the small practice that Dad and I had for a few years. So the special things about Orthopaedic Medical Group include the ability to provide care to so many different people regardless of insurance. We see all pathologies, whether it's hand, foot, ankle, spine, the back, and then again with the different types of insurance companies, whether it's workman's compensation, Medicare, even automobile accidents. We're proud to care for all aspects of orthopedic surgery. That's just a few of the things that really make Orthopaedic Medical Group unique and different for this community.
We've had a tremendous amount of growth over the last several years at Orthopaedic Medical Group, and we thank very much the Tampa area for supporting us. And we think we've had an opportunity to grow not only because of the growth of the city, but also just the change in mindset for this type of treatment in the area. I think the mindset that we've brought is very much listen to the patient, give them multiple different treatment options, try to manage them without surgery when possible, and then provide the highest quality operations and get the best outcomes when it comes to that. So we've been able to expand all the way from St. Petersburg on our western front out towards Winter Haven on the eastern side, and have 7 different offices now, including St. Pete, Tampa, 2 in Brandon, Riverview, Plant City, and Winter Haven. So we've had a tremendous amount of growth and success, and that's in large part because the patients have supported our concept of growth.
I pride myself on being kind of on time and punctual. That's just part of my personality. That being said, I will take as much time as it's needed to make sure a patient's comfortable. So while I like to be, keep things moving and seeing patients so people aren't waiting, if there's a complicated story, problem, situation, I'm going to take my time. And so I'll do that with everyone. Some people say I'm a little dry, so I might not talk socially, but I'm going to give 100% focus on the problem. That's number one. Number two is I feel like I'm an educator. This came from my academic background. So I'm not going to leave the room until a patient understands what the problem is. Number three, I like to give patients options, and I think it's best for patients to know their options, and hopefully they make the informed decision and they make the decision that's best for them. Some patients don't like that, and if I've sensed that, when push comes to shove, I'll say, all right, I'm giving you the options, but this is my recommendation. So hopefully we come up to the same conclusion.
So I do a lot of general orthopedics. My fellowship training was in sports medicine, so that's really my passion and my primary focus. But I do about 50% sports medicine, 50% general orthopedics. So a wide range of surgeries involving the shoulder, hip, knee, elbow, ankle, anywhere from arthroscopic surgeries, ligament reconstructions, shoulder stabilizations, all the way to fracture work, and smaller general orthopedic cases like carpal tunnels, trigger fingers.
If you ever have anybody who goes through a medical situation, you get a very deep understanding of what it means to be a patient, and I don't think that's easy. So I would say, yeah, I'm a person like you are and like anyone else is, and so I think that's one big thing. I think the second thing is that I'm passionate about my patients, and I'm passionate about getting excellent results, and hopefully not just good enough results. And so that really does keep me awake some nights and early mornings to make sure that I'm driven so that those people can get the best results they can. And if we don't have the answer for you, then we're going to get it for you. So I guess that's the part that it just doesn't stop of you have 5 minutes or 15 minutes or 50 minutes and then you're gone. I mean, it's a relationship, it's a back and forth, and we're not perfect. I'm not perfect, but I think that I'm very hardworking, and I think that we have set up a system where we really do care about people here. We care about their families, we care about their outcomes, and we don't just, care about you for the time that you're in the office.
So I specialize and I operate in hand and wrist disorders. So, disorders such as carpal tunnel, trigger finger, wrist fractures, finger fractures are one of the more common things I see. But, I do anything from arthritis also to Dupuytren's disorder. I can operate both on soft tissue disorders like carpal tunnel and trigger finger and tendon injuries, but I can also fix bones like fractures of the hand and the wrist. So it's a wide spectrum of disorders, and that's what makes hand surgery more unique than other orthopedic specialties.
Right.
So the great thing about hand is that there are 10 fingers, and so lots of problems. And so what I end up happening to see is that I see patients for one problem, but then they come back to me for another problem. And so I like really spending time with my patients because I will be seeing them for a lot of other conditions in the hand that they didn't originally come to see me for.
My name is Dr. Scott Goldsmith. After growing up in Tampa, I attended University of Michigan for a fabulous 4 years, go blue, and finished up there with a major in biology. Headed over to Chicago, where I did a master's in physiology for a year at the Chicago Medical School, followed by 4 years at that same facility, and finished up with a medical degree in 2001 at Chicago Medical School. From there, my journey took me to New York City, where I followed my fiance at the time and soon-to-be wife. I did a year of general surgery internship at St. Vincent's Hospital starting in July 2001. That was a wonderful year, but I had a change of heart and didn't want to be a general surgeon anymore, and fell in love with orthopedics, which I had grown up with through my dad. Ended up transferring over to Lenox Hill Hospital, which ironically was where my wife was also working and training to be a doctor, and spent 5 wonderful years at Lenox Hill Hospital on the Upper East Side of New York City. Following that terrific training, which included 6 months in Boston at Boston Children's Hospital learning pediatrics, also spent 4 months at shock trauma in Baltimore at the University of Maryland Shock Trauma Center doing trauma, as there's not too many highways in New York City, so you have to go somewhere else to learn trauma, orthopedic trauma. Following graduation from Lenox Hill and orthopedic residency, I spent 1 year just down the street at New York University Hospital for Joint Diseases, where I completed a sports fellowship in 2008, and then finished up and came down to Tampa to start my practice.
Dr. Jeff Watson, one of the senior partners at Orthopaedic Medical Group of Tampa Bay. I primarily focus on sports medicine, but also do general orthopedics. I started in medicine after I did a stint in the Air Force. I graduated from the Air Force Academy. Saw a lot of opportunity to help members of the United States Armed Forces. So went into medical school and specialized in orthopedics, which I saw as a very useful field for the military. I met the senior partners, Dr. Scott and Stuart Goldsmith, years ago, and we had a conversation about our philosophy of medicine and how to run a practice, and we had complete agreement and alignment, and so I joined them early on after completing my tour in the Air Force, and everything has grown since then, and come along for the ride.
My name is Brian Butler. I'm an orthopedic surgeon with the Orthopaedic Medical Group of Tampa Bay. I went to Northwestern University for my undergrad. I had a double major in biological sciences and economics, and I did a honors in economics. So I finished there, and then I applied to med school, and I went to medical school at the University of Maryland. I did well there, and then I had different options to go to many different residencies, but I chose to stay at University of Maryland, so I stayed another 5 years there. I was an academic chief, so the head chief resident my 5th year there. I had a great mentor who was a shoulder and elbow specialist, Dr. Anand Murthy, and he helped me get to the next step, and the next step was a fellowship in shoulder and elbow surgery. So then I went to the Harvard program in Massachusetts. So at Massachusetts General Hospital and Brigham and Women's Hospital, I mentored under 2 great guys, Dr. Larry Higgins and Dr. J.P. Warner, world-renowned surgeons. And that's where I kind of honed my shoulder and elbow skills. In addition, they had an option to go overseas. And so for 2 months, I went to France and learned some advanced shoulder arthroscopy techniques. But it wasn't ending there because I got a lot of shoulder training during that time, but I didn't get a lot of elbow training. So I spent another 4 or 5 months doing some observerships to learn elbow. And I stayed there at MGH for about 4 months, following a few surgeons there. And then I did 1 month observership at Mayo in Rochester, Minnesota. So that was my training. After that, I had a passion for academics, which is an academic practice. And there you get to do the same stuff you do in a private practice in regards to clinical care. But I got to train residents and do research. And so my first job after fellowship was to go be assistant professor at Ohio State University. I was there for about 2.5 years, and then I got recruited to go to another institution, another academic center, and that was at the Medical University of South Carolina in Charleston. So I was there, I was doing well, but then kind of life got in the way, and I started having family, and so I had a young kid, 2 years, another one on the way, and I decided to join a private practice group so I could help balance my time a little more. And so I reached out to Orthopaedic Medical Group, and I joined this practice, which consists of great surgeons, but also people I have known in my previous training.
I'm Dr. Mark Sando. I'm an orthopedic surgeon here at Orthopaedic Medical Group in Tampa Bay. I originally am from Buffalo, New York. I started my undergraduate career at Canisius College, small school in Buffalo. Went on to medical school at Case Western Reserve University in Cleveland. From there, I went to residency at University of Maryland, where I completed my orthopedic surgery training at University of Maryland, and then went on to sports medicine fellowship at Krill and Jobe Orthopedic Clinic in Los Angeles, California.
I think one of the most important things that patients need to know when they come into our office is that they're getting a unique overall experience in care. It starts with the phone call to our service center. It goes through check-in. It goes through the medical assistant taking their vital signs, the x-ray technician who certainly takes x-rays, and then getting placed in a room where they may see a medical assistant or athletic trainer. When they see the physician assistant or the surgeon, they should know that the care that they're being provided is dedicated to them. It's not about what insurance you have. It's not about anything else except caring for that person at that particular time. And we follow you through all of your care. We will provide wonderful non-operative management, and then if and when surgery is required, we will provide great care all the way through the surgical experience, from our surgical coordinators all the way through the post-operative care with therapy and so forth. I think that is something that the patient should know coming in, that we are dedicated to getting them better. So if they are dedicated to getting themselves better, it's a wonderful win-win situation, which all the time equals great results.
One of the messages I'd like to convey to patients that would be prospective patients at Orthopaedic Medical Group is that we are truly set up to be able to treat you in a number of different ways. So you don't have to assume that walking into our door, surgery is the one and only option that you have available to you. Certainly have seen a tremendous amount of success from other options, such as minimally invasive procedures such as injections, just changes in diet and exercise, getting people reconditioned, and having them, have an opportunity to heal themselves and have their bodies heal themselves instead of us jumping to a mechanical fix as the first option for a patient. Orthopaedic Medical Group provides high quality care, and we try to reach out to all the patients in the Tampa area. So we take all insurances, we treat all conditions, and we also do the specialty types of access. So patients that don't have insurance, workers' compensation, personal injury, we really want to be able to treat everyone. There's a lot of information, but it's incomplete information related to biologic injections such as stem cell injections or platelet-rich plasma. We're at the beginning of a phase of medicine where the emphasis on biologic healing has really grown. And although we haven't filled in all the data and done enough research to get to the place that we want, we can see the trend heading towards having an opportunity to heal some of the patients where we traditionally did an operation previously. I think a patient is best to make a relationship with a physician that has some experience and background there, because it can be overwhelming if you just look at the information that's provided you through social media or marketing campaigns. This should really be a treatment that's done by a physician that you trust has the appropriate diagnosis and knows how to deliver the biologic injection to where you want that injection to go. So for us, we focus mostly on doing injections from the patient's own biologic material or autograft material. So we tend to do your own blood draw, fat harvest, or bone marrow harvest to get the growth factors and cells we believe are going to give you the best option. There are other alternatives such as taking allograft tissue. But again, that's a conversation that I think each patient should have with a physician.
I am Chris Donaldson. I am a general orthopedic surgeon and shoulder and elbow specialist at the Orthopaedic Medical Group of Tampa Bay. So I am 10 years into practice. I have trained at Juniata College for my undergrad, where I played lacrosse as a club sport, and was at Penn State's College of Medicine in Hershey, where I had an interest in orthopedics and sports medicine. And then was at the University of Maryland, where I did a general orthopedic residency and had interest in sports there as well. So a lot of team coverage with the Terps and with some local high schools. Did a year of research. That kind of developed my interest of asking good questions, which I would sort of later pick up at Ohio State, where I did my sports fellowship. So my sports fellowship was a year-long fellowship with the Buckeyes. I took care of their football and wrestling, baseball teams, many national and Big Ten championships. So taking care of elite athletes was challenging and complex work, but I also got to ask really good questions with my mentors and my fellowship directors, and that sort of even propagated into an opportunity to do some development work with intellectual property and sort of implants and surgical instruments that I continue to do with some industry today as I practice here in Tampa.
I'm Dr. Tao Nguyen. I'm a hand and wrist surgeon at Orthopaedic Medical Group. I did my undergraduate training at GW, where I majored in anthropology. And then I went to medical school at University of Maryland, where I stayed and did my orthopedic residency. And then I went to University of Pittsburgh to do my specialized training for hand surgery.
In several of the facilities I operate, robotic total knee replacement or robotic assisted knee replacement is now in place. This includes the ability to make more precise cuts. At several of the institutions where I operate, robotic assisted surgery is now in place. This allows the surgeon to use the robot to make precise and accurate cuts. This makes sure that the implants get put in exactly as the surgeon intended, which we believe will ultimately lead to better results.
When a patient walks through our door, we're truly partners with them and helping them with their care. Part of it is what we do as a physician. Part of it is their response, because orthopedics is a very physical thing. So when you have an operation, do you have the time and energy to be able to put in the rehabilitation? A lot of the conditions are improved simply by weight loss or other physical activities. So we're really trying to put together an ecosystem that allows patients access to nutrition counseling, physical therapy, sports performance, a gym, all the resources that they could use in order to get better, so that we give them the opportunity to put in their part to their part of the equation.
Misconceptions with orthopedics, specifically shoulder surgery, is that as a patient you get your procedure done and then instantly you're going to be better. And that's not the case. There's only a few surgeries we do in the shoulder where someone would expect immediate relief maybe within the first 2 or 3 weeks. At a minimum, most things we do in the shoulder requires at least 3 months of therapy, recovery time. So what happens is when you have shoulder surgery, your body senses the insult, which is the surgery, and it tries to heal it, which is good, but on the other hand, it gets you stiff. So the shoulder is the most mobile joint in the body, and it does not like to be stiff. So the first 6 weeks, 8 weeks of post-surgery, whether it's a rotator cuff, joint replacement, labral repair, is just trying to get your motion back. So imagine not moving your shoulder for about 6 to 8 weeks and having this kind of like rubber band stiffness. So then patients get over that, and they haven't really used it very much, and so now they're weak and they have some atrophy. So then it takes another month or two to get back your strength. So the shoulder surgery part, is technical, we're good at it, but the ultimate recovery relies on how hard and how diligent a patient's going to work afterwards, and that's with the physical therapist. So with simple surgeries, cleanouts, debridements, then you might expect a patient to be 100% by 2 or 3 months. With rotator cuff repairs, which is very common surgery, I tell patients 5 or 6 months. Joint replacements, kind of in the middle, maybe 2 to 3 months, until patients are basically functional and very happy with their outcome.
My favorite surgery to perform is anterior cruciate ligament reconstruction, or ACL reconstruction. It's a pretty common surgery that we do in a lot of patients, from teenagers all the way up into folks in their early 50s and 60s, sometimes depending on their activity level. It's a very unique surgery. We get to restore function, we get to stabilize the knee. It can be done arthroscopically through small incisions. We can take a patient's graft, or we can use an allograft tissue. And I just enjoy being able to watch the patients go through the recovery and get back to the function that they do. It's also a lot of fun to put cadaver tendon. So for folks who don't want to use their own tissue for the ACL reconstruction, we can use a cadaver tendon to make them a new ligament. For folks who are a little bit older, folks in their late 30s, early 40s, who aren't quite as active as the young patient, we may recommend doing that. There are higher re-tear rates in the younger patients using allograft, but not as much in the older patients. And so for some of them, we can get by with using the allograft tissue without that re-tear rate. And it's a little less painful, the surgery. We don't have to harvest tissue from them. And so the surgery itself goes a little faster with a little less discomfort.
treat mostly sports medicine, so a lot of anterior cruciate ligament tears, rotator cuff tears, things that go along with an active person. One of the areas where I've focused is on non-operative care or minimally invasive procedures. So one of the opportunities that I've enjoyed the last couple of years has been able to do platelet-rich plasma, stem cell injections, biologic healing so that patients can go under minimally invasive procedures and sometimes achieve the same results that they might from open surgery. I'd like the patients to know that I'm open-minded and I'm open to hearing what they've done and their perception of their injury. A lot of people, I think, feel when they come into the doctor that they're going to get everything placed into a small diagnosis or a little box and focus on one particular body part. So in orthopedics in particular, a lot of times we sign, somebody, you have a knee problem, a hip problem. I want patients to know that I do care about their overall well-being and their full body function. So one of the things that we've done is we've actually incorporated physical therapy, a gym, a sports performance center in conjunction with our orthopedic office so that there's an opportunity for people. Sometimes all it requires is weight loss or some strength and conditioning to overcome a problem that someone was considering a surgical treatment for.
I think I want patients to know that I'm here to try to help them. I'm here to listen to what their problem is, listen to what they've done in the past, what their hopes, what their expectations are for treatment. But I'm also here to give them my best opinion. Now, sometimes that may not be what they want to hear or what they were hoping to hear, but I'm not doing it in any reason to upset them or to make them do something that I want them to do. Doing what I think will be best for them. I want them to try to understand that, and I'm willing to work with them and meet people to come up with a plan that's tailored to them and meets them. I don't think that everyone fits into a cookie cutter when it comes to treatment of an injury. While we have, you look at a textbook and some of the literature may say you go this way, some may say you go that way. Each patient is different. And so I think it's important to know a variety of both surgical and non-surgical techniques to treat various injuries. I think I have a good breadth of understanding of that, and I like to go through that with my patients so that they really have a good understanding of what our treatment goals are going to be, what work they're going to have to put into it, what work I'll put into it, and that we'll work together to get them a good outcome.
So I think the things that really stimulate me as far as thought or technology are the advances arthroscopically around the shoulder. I think there's so much now that we can do around the shoulder. And then when you say arthroscopic surgery, that sort of triggers in everyone's mind, well, now it's outpatient and it's pretty slick and convenient surgery. And that's I think all true. But I think there's a lot of forethought and planning that goes into that. And to take that thing, arthroscopic surgery, to the next level of reconstructing somebody's joint and doing that as an outpatient. So it really is patient care delivery that I think I'm most passionate about and the things that really interest me most. So how do we build a better mousetrap? Whether that's arthroscopic anchors or instruments, scopes, doing a technique in a different approach, or replacing somebody's shoulder or not replacing somebody's shoulder. I mean, I think it's not just about that operation. It's about how do we control for their pain or constipation or dizziness or whatever it might have been. So I think it's a holistic approach when it really does come down to it. And the things I'm passionate about that I think are very interesting are advances around the shoulder, because we have so much technology, arthroscopic and open, that we can do that I'm really excited about. And you take rotator cuff where we used to say, well, there's a huge rotator cuff tear, we can't fix that. Now we've got patches and tendon transfers and all those things that we do, but that's going to fail if you don't correctly immobilize the patient, if you don't get them to the right therapist, if you don't have the right protocol. And that will fail if you don't have them comfortable throughout their postoperative course. So how do we do that? Well, now we've got to talk to the anesthesiologists who are going to do special blocks, and then we're going to get better medicines or different medicines or even older medicines that are now used in a different way to reduce blood loss and improve upon the constipation, the dizziness, the nausea. So if we make your experience one that you say, I thought it was going to be terrible, but I would much rather come back and do that again if I could to see Dr. Donaldson because I didn't have the nausea, or I didn't have the pain, or I didn't have this, or I did and it was controlled and it was much less than I thought it was going to be severity-wise, then that's a success,
So carpal tunnel is when the nerve in your wrist gets pinched right here. And so what happens when the nerve is pinched over time is that you get numbness in these three fingers. Eventually, if this nerve continues to be pinched for a long period of time, it affects the function of your thumb. And so the goal of the surgery for me is to get rid of your numbness and to prevent the weakness of the thumb.
A repair is something where you take that native tissue and say, for instance, the rotator cuff is most straightforward, that tendon, and bring it back to the attachment to the bone. That's repairing the tendon, that's repairing the rotator cuff. Reconstructing the rotator cuff would be using something that is not its native material, so not the tendon, like a graft to bridge between, to replace or to make new that rotator cuff. So arthroscopy, in the simplest of terms, is basically using a very small camera, typically about the size of a pencil, to get into a joint. And arthroscopy, by its nature, in orthopedic terms, for bones and joints, uses water to allow that camera to function properly with the appropriate lighting, because the camera can be a little bit hotter to the joint, and we don't want to damage the joint, so we have fluid that goes through it. That's the water. So it allows us to basically see in an underwater, with an underwater camera, into your shoulder or knee or wrist or wherever that might be. Open surgery, by contrast, is one that is done through an incision, and that incision size can be larger, like 10, 15 centimeters, or it can be very small, an inch or less. So I don't think the size of the incision dictates whether it's arthroscopic or open, but the use of the technology of that camera to look in certain places for us orthopedically into joints is really the difference between open and arthroscopic surgery.
So trigger finger is when you have locking or clicking of your finger, and so patients will often complain about their fingers locking down like this and they have to open it up. And it's because the tendons in the finger travel through a tunnel right here, and that tunnel can get tight over time because of inflammation. And so what happens is that the tendon gets stuck in that tunnel, and that's why the finger trigger when they open and close their finger.